We prepare to do an exposure of the gluteal region. For orientation, we show superiorly the iliac crest, laterally the greater trochanter, medially and inferiorly the ischial tuberosity, and the sacrum in the midline. We show the location of the sciatic nerve, which is approximately halfway between the greater trochanter and the ischial tuberosity. A sciatic nerve block could be performed at this site. It is important to avoid damage to the sciatic nerve and superior gluteal nerves in intramuscular injections. For that reason, the injections are performed in the superior lateral quadrant. Because of the close approximation of the sacrum and the skin overlying it, this is a common location for pressure sores. We indicate one here. We've removed the skin and fascia covering the gluteal region and the posterior thigh. For orientation, we show the iliac crest and the position of the greater trochanter and the ischial tuberosity. And we note the depth of the pressure sore, which we indicate here. We show the origin of the gluteus maximus along the iliac crest and the sacrum, and we show its insertion along the iliotibial tract and its inferior fibers, which insert on the gluteal tuberosity on the posterior femur. We now divide the gluteus maximus at its origin and reflect it laterally. Deep to the gluteus maximus, the gluteus medius is coming into view. We've reflected the gluteus maximus inferiorly. We show the gluteus medius muscle and the piriformis muscle. Along the superior border of the piriformis, we have divided branches of the superior gluteal vessels. Inferior to the piriformis, we show inferior gluteal vessels and the inferior gluteal nerve, which supplies the gluteus maximus. Laterally, you can see the cut edge of the trochanteric bursa on the deep surface of the gluteus maximus and on the greater trochanter. The sciatic nerve is beginning to come into view. We now divide the inferior gluteal vessels and nerves in order to continue our exposure of the sciatic nerve. We retract the gluteus medius muscle to show the superior gluteal vessels and nerves passing between the gluteus medius and the gluteus minimus. Inferior to the piriformis, we continue to follow the sciatic nerve and see it's accompanied by prominent vessels. Medially, we show the sacrotuberous ligament, which forms part of the boundary of the lesser sciatic foramen, through which the internal pudendal vessels and nerves and the obturator tendon pass. We continue our reflection of the gluteus maximus muscle. For orientation, we show the greater trochanter and the sacrotuberous ligament running from the sacrum to the ischial tuberosity. We now separate the gluteus maximus from its attachment to the sacrotuberous ligament. This is a higher power view of the region of the greater and lesser sciatic foramen. For orientation, again, we show the gluteus medius muscle, the greater trochanter, the deep surface of the gluteus maximus muscle, the anal canal in the ischial-rectal fossa, the sacrotuberous ligament, the piriformis muscle, and the sciatic nerve. Deep to the sciatic nerve, we identify the tendon of the obturator internus, and we follow it medially to show its muscular portion passing through the lesser sciatic foramen. We also identify two accessory muscles, the superior and inferior gemelli. Medially and inferior to the piriformis, we show the pudendal nerve and the internal pudendal vessels. We reflect these structures laterally to show the sacrospinous ligament, and medially to show the attachment of the ligament to the ischial spine.